I'll kick off, and I just wanted to start by introducing you a little bit to THET, the Tropical Health and Education Trust, and really why we're involved in this space. So over 30 years ago, THET was set up by a GP who has now been sort of totally influential in the world of medical healthcare particularly across Africa. We now work across Africa and Asia in lower and middle income countries to support health workers and those associated with them in terms of strengthening their skills and the systems that they work within. And we do this through a model of health partnerships, and this is a way of partnering UK health institutions, be that NHS trusts, universities or NGOs, with their counterparts overseas. So again, predominantly across Africa and Southeast Asia. And in the last 10 years alone, we've reached over 100,000 health workers across 31 countries. And interestingly enough, with 130 UK institutions involved. So hopefully, many of the 83% who've taken part before will be on the call with us as well today. This is a sort of overview of where THET are based. So we have an office in the UK, but we also have a presence in countries again across Africa and Southeast Asia, with full country offices in Myanmar, Tanzania, Uganda, Somaliland, Ethiopia, and Zambia. And hopefully I haven't forgotten anywhere in that list. But as you can see, we're sort of fairly centralised in terms of Africa and Southeast Asia, but there are other programmes of work going on. And how this feeds into the NHS. So recently, with the support of the Bill and Melinda Gates Foundation, Health Education England, we ventured into understanding what the levels of engagement look like within the NHS for global health activities. And again, as I said at the beginning, this is anything from virtual or armchair volunteering all the way through to placements or fellowships overseas. We were really pleased that from our respondents, which was about 400 NHS staff, which we of course know doesn't speak for the vast number of the NHS workforce that there are, but from across the UK and the 400 respondents who participated in the Ipsos Mori research, we found that 62% had actively participated, which is obviously fairly similar to today's turnout as well. And 41% of those who'd taken part wanted to do so because of solidarity or altruism. And others were in terms of gaining new skills for themselves or improving the care that they can provide back in the NHS. We also found, sadly, that there are, of course, barriers to this engagement, and Going Global in the series that will sort of go on after this one today will look at how we can get around those barriers and how we can strengthen management support for global engagement within NHS trusts. So if you happen to be one of those that are worried about how your trust feels about global health activity within it, or needs further support from your management structure, or are part of a management structure in the NHS and would like more materials to demonstrate the benefits of this, this is part of what that does and what we hope to support as well with our partnership with HEE. So as you can see here, the global pandemic, of course, is one of them. At UK aid being cut has really meant that many of our programmes as a charity have also been cut, so our opportunities for global engagement and supporting NHS and UK health workers into global engagement activities has really been cut. But we're also finding that within the NHS itself, there are barriers as well. So worries around job retention, lack of opportunity, and of course family obligations, not being able to leave home due to caring responsibilities and financial reasons. But hopefully over the course of this series as well, you'll also see that there are many ways to become engaged, and Helen will demonstrate some of this next, and so will Sophie. But there are also other ways. We'll talk to virtual volunteering, we'll talk to mentorship and online community support, as well as that more sort of traditional form of in-person placement opportunities and training. But based on the research as well, we also wanted to flag a campaign that we're running at the moment called HEAL. And this stands for Health Equality for All, something that's at the core of that. And essentially this campaign is really aimed at amplifying the voices of health workers across the UK who are involved in global engagement work or would like to become involved in it, so that we can demonstrate the sheer force that there is within the UK for wanting to be a part of this. And that's both in terms of encouraging the UK government to commit more in terms of UK aid and funding, but also in terms of the NHS trust structure and how we can again ask managers within that structure to become bigger supports of that. So hopefully over the next 9 months, you'll also see some activities that, if you'd like to, you can become a part of and share your own experiences through that. And I'll share a link in the chat box now as well, which should take you to more information on all of the ways that you can get involved with THET'S work following today. So that's sort of that in a nutshell and where we're landing at the start of today's webinar. I just wanted to check if there were any initial questions or thoughts before I pass on to Helen, who is going to speak to HE's role in all of this and help orientate, hopefully, the rest of the series in that. Fantastic. Well, hopefully I've stunned you into a positive silence. And so I will now move on to introduce Helen, who's the project manager for Global Health Partnerships at Health Education England, and who has helped to design this Going Global webinar series in collaboration with her colleague Blair Kitzel as well, who you'll meet later on in the series. So thank you, Helen. Over to you.
Thank you, Charlotte, and thank you to THET for inviting me to speak to everybody today. As Charlotte said, I'm Helen Slattery. I'm a project manager with Health Education England's Global Health Partnerships Directorate. And over the next few slides, I hope to share with you Health Education England's remit in the global space, why we're interested in it, and in particular, our refreshed strategy. Our strategy was first developed in 2018, and over the last few months, we've recognised there are changes that are happening, and we've developed a new refreshed strategy, and it's been out for consultation. We're in the final period of the consultation, so we're expecting that what you see is broadly how it will be in the future. So if you're not aware, Health Education England are the UK's largest national health body, and we're responsible for workforce and education training and also planning, transformation, development support for current and future NHS workforce. Recently, as I said, there have been a range of political, economic, global and environmental changes globally, and combined with the impact of COVID, have changed the way that the NHS operates and the requirements of a global workforce. And the strategy reflects the need to follow the direction of government strategies and plans on global health, as well as being aware of our own strategic framework, the NHS Workforce Strategy, and the publication of the new Health Education England National Operating Model. So next slide, Charlotte. So what can we bring to a global workforce strategy? Well, Health Education England will continue to strengthen health systems and services in England by bilateral and multilateral mutually beneficial partnerships in order to attract, educate and train an international health workforce. Because we have the responsibility of education and training, we've got access to NHS expertise, but also our infrastructure in education and training, which can support staff who have come to us from overseas. We offer a gold standard fellowship programme, which offers value for money and development opportunities, and these can be aligned to global health objectives, should they be required. We have very good relationships, and with a range of our programmes, we work with the Foreign, Commonwealth and Development Office, the Department for International Trade, and the World Health Organization. And we've got a reach into the NHS to be able for us to do this. We host and lead well-developed models to support arm's length bodies, collaboration with global health programs, and these can be applied beyond the overseas trade budget, aid budget. Thank you. Next slide. So our three main areas that we have prioritised and are out for consultation, but as I said, they're unlikely to change very much. The first one is, what do we offer for the individual in the NHS? And we're aware that this needs to cover lifelong learning and career progression, And the ways in which we can do this are to develop individuals, attract more people into the global space, and promote diversity in leadership. Number 2 is NHS system strengthening. So it's an offer to the population of England through mutually beneficial partnerships to benefit NHS organisations and systems. And an example of this is to increase the number of overseas staff who are able to work in the NHS and support those who have come here to meet patient needs. The third priority is an offer to the world to facilitate mutual health system strengthening for other health workforces, using our expertise and working with our partners to create solutions. And because we have great access to the NHS expertise, we can help with this. We can promote our expertise in health system strengthening and also look towards commercial models. So the strategic priority in a little bit more detail, the individual offer, or the offer to the individual. This could be via fellowships, volunteering, peer-to-peer learning. Individuals and the NHS benefit from the development opportunity, and in doing so, we're also supporting a host organisation. While we recognise there are some gaps at the moment in the system, we're committed to increasing the quality and quantity of global opportunities. We also recognise that learning in a global context doesn't automatically mean a placement in a low middle income country. It can also involve what we might call armchair volunteering, which is otherwise virtual volunteering, not needing to travel. And all of these opportunities we intend to promote. And the reason we're very interested in it is because the skills that people develop from participating in global health, sort of skills like leadership, emotional intelligence, resilience, are what we need in our future and current NHS system. So our strategic priority number 2, we recognise in order for health systems to be effective, they need a workforce which is adaptable and resilient. So in order to do this, we offer high quality education-based pathways responsive to local needs. And what we're not doing is a sort of international recruitment pathway, but we do want to continue education as a way of promoting a bilateral ethical recruitment to strengthen the NHS. And we have got significant experience in establishing this. And we're often told by regional directors and teams that a global element does improve recruitment, retention and job satisfaction. So another reason for the NHS to support this opportunity for individuals. Strategic priority number 3 is the is supported by high quality learning environments. And some interesting statistics for you there. 1 million patients are treated every 17 hours by the NHS. And also 77% of our population believe the NHS is crucial for British society. And we have 1.4 million staff within the NHS. So the global system strengthening offer, there is an increasing demand for NHS expertise and services globally, and we can provide a platform for system-to-system knowledge exchange. We've got a very positive relationship, I've said earlier, with the Foreign Commonwealth and Development Office and the Better Health Programme. And this is an initiative of the FCDO and the Prosperity Fund, and it aims to address the burden of non-communicable diseases such as heart disease and diabetes in low middle income country settings using NHS expertise. And we're actually working with 8 countries in this initiative. Next slide, please, Charlotte. So our offer to the world, the primary focus of our global health system strengthening offer is knowledge exchange and sharing NHS expertise. As a national body, we have strong links across the system to facilitate knowledge exchange, whilst having the expertise in workforce planning, education and training. And we want to increase the number and quality of bilateral partnerships. Within this strategy, while aligning with government priorities, particularly of the FCDO and the Department of Health and Social Care, we have the opportunity to look at the development of a commercial offer to support the sustainability of our work and reinvest in the NHS. So next slide. So 2021 is the year of the healthcare worker, and designated by the World Health Organization. And this was in recognition of the work of millions of health and care workers at the forefront of the COVID pandemic. But the main messages have been from this that they wish to help others to understand there needs to be investment in people, in health and care workers, education and employment. And within Health Education England, our year of the health and care worker particularly seeks to strengthen health and care systems development. And this is via using our education and training expertise. So examples are online seminars, for example, that are open to participants from the UK and low middle income country settings. Next slide, please, Charlotte. And here is some research. Very often, managers and policymakers want to know what is the advantages or the benefits for NHS workforce from participating in international volunteering. And very often, or previously to this piece of research, it was often narratives and case studies. And this particular piece of research wanted to examine whether there were particular outcomes that were achieved by volunteers. And they identified 133, and these were broken down into 7 domains. And 4 of the domains are listed there, as you can see. So the knowledge, for an example, that people were saying that they achieved were encountering unusual diseases, participation in healthcare, and understanding a little bit more about cultural aspects. And skills that people came out with were clinical skill development, it could be management and leadership competencies, and other transferable skills such as communication and working with others. Others, attitudes, it found that volunteers reported that they had increased confidence, more cultural and emotional intelligence, and broader recognition really of the work of the NHS. And in terms of organisational, felt that it improved staff retention and productivity and made working in healthcare attractive. Thank you, Charlotte.
Thank you so much, Helen. That was fantastic, and hopefully provided, well, I think it did provide, but hopefully for those who aren't aware of HE's global work in particular, has provided a really in-depth overview of the work that's going on there, and it's really vital. I think, as you said, Helen, moving across those 3 core pillars is really close to THET'S work as well, and I know many others who are on the call. So I just wanted to pause. I haven't seen any questions pop up in the chat box, but before I hand over to our next speaker, I just wanted to check that there weren't any points that had come up during that, and there will be some time as well at the end where we can reflect. Fantastic. Okay, well, I'm really pleased to welcome our next speaker, Sophie, who's joining us from the Cambridge Global Health Partnerships team. The reason it's lovely to have Sophie here is partly because the team at Cambridge Global Health Partnerships are such a core hub of health partnership working, and have been for many, many years, as I'm sure Sophie will touch on. But it also is fantastic to have them here with us, because I think it's really demonstrating the strength of health partnerships associated with NHS trusts and how they can support global learners and volunteers within the trusts, perhaps more directly than we can as an organisation who are sometimes a little bit more removed. So I'm really pleased to hand over to Sophie now.
Thank you,
to let you
Thank you.
share screens. Yeah.
Great. Oh, brill. Thank you. I hope everyone can see that all right. Great. Okay. Hi, I'm Sophie Ward and I am Communications and Fundraising Lead for Cambridge Global Health Partnerships. And yeah, it's great to be here today. I came to one of the Going Global events a number of years back, so it's lovely to be back here, but presenting. So just a bit of background. I previously was Programme Officer for Cambridge Global Health Partnerships, so I spent about 2.5 years working very closely with volunteers, and I have to say it's just always remained a highlight of my job. So it's great to be able to talk about sort of how we engage with volunteers. So just to give a little overview of exactly who we are as an organisation and what we do. So we're based in Cambridge. We're a global health charity. We're on the Cambridge Biomedical Campus, so a real hub for medicine and science. So we're linked with Cambridge University Hospitals, but also now with Royal Papworth, so the big cardiothoracic hospital, and a couple of other health institutions nearby. So we began in 2007, and we began because, well, we were born out of the belief that everybody deserves access to high quality healthcare, but also out of recognition that there were a large number of people within, at the time, Cambridge University Hospitals that were getting involved in global activity, but perhaps needed a sort of formalised way of doing that would be safe, effective and ethical, both for the NHS healthcare workers that were doing this activity, but also those overseas low middle income recipients of their volunteering. So that's how we began. So we're quite a small team. There's just 4 of us, 3 at the moment, and we are all from international development background, but have quite a bit of experience now in global health. So in terms of exactly what we do, so I always think of us as having 2 arms, really. We kind of function as, we like to think of ourselves as a hub, a global health hub for Cambridge and more widely the East of England region. But our sort of 2 big areas of work are firstly our health partnerships, which, as Charlotte mentioned earlier, they're, you know, about these long-term sustainable links between healthcare institutions in the UK and also healthcare institutions in low middle income countries. And we have a number of partnerships in Africa, Asia, and also Latin America, and they all have a different specialty focus and very different healthcare workers that are involved, for example, maternal health or eye health, trauma and orthopedics. So they're quite wide ranging and very sort of long lasting. So that's one big area of our work, but then the other area of our work is wider global health engagement. So we have events, networking, we're increasingly trying to do a bit of sort of global health advocacy and offering support services beyond our health partnerships for healthcare workers in the surrounding hospitals that are interested in getting involved in global health activity. So, oh, I think, yeah, there we go. So in terms of what we offer and how we link in with volunteers, so the way we function is we've got a tiered system of support. So at the bottom, where we engage with a very large group of people, we offer events, we offer some guidance. So individuals that are interested, perhaps like yourselves, in getting involved in some sort of global health activity can pop into one of our drop-in sessions. We now have them online. And we just try to dig deep into our brains and help out anybody that's looking for an opportunity or for some advice. So that's sort of part of what we do. The next level up, we offer a grant scheme. So we offer, it's not a particularly large amount, but we offer some funding for individuals at the sort of Cambridge hospitals that are wanting to go overseas, perhaps with another organisation. So actually this image, so the lady that's at the back, she had a grant from us a number of years ago to go to Ethiopia with, I think it was Smile Train. So we offer that sort of support as well for people interested in getting involved in global health. We also link with the University of Cambridge, and we offer student elective opportunities within our health partnerships too. And we also have something which is quite cool. We've agreed this with with Cambridge University Hospitals, and it's a volunteer release scheme. So it's quite innovative. It's essentially a bank of days that volunteers are able to use for the purposes of global health volunteering. So we also manage that as well. And then finally, at the sort of very top bit of our sort of support structure, we offer opportunities to volunteer within our global health partnerships. So whilst we're quite a small team, we have a lovely pool of volunteers that deliver all of our health partnership activity. So yeah, so that's sort of at the very top, and that's the all bells and whistles sort of opportunity that we offer. So I just thought I'd talk a little bit briefly about what that opportunity looks like and what it's like to volunteer within one of our health partnerships. So I was sort of going through some pictures and thought these kind of quite well sum it up really. Our health partnerships, like Charlotte said, they're all based on training and education and sharing knowledge and skills. It's not about going overseas and delivering services. So I think these images demonstrate that, I think, quite nicely, and learning about our partners and our partners coming to the UK and learning a bit more about us. So when we have individuals that are interested in getting involved with us, we do make it quite clear that health partnerships are about long-term engagement. They're not so much about spending a couple of sort of months overseas and then sort of moving on from that experience. Our model is people get involved, they come to regular meetings, and they stay engaged with partners, you know, whether they go abroad or whether they stay here in the UK and just sort of offer that armchair volunteering. So the number of different, well, a selection of the different opportunities we do have, though, are long-term volunteering placements. So within our partnerships, we do always ask that people are coming to regular meetings and doing that sort of continued engagement, but we offer sort of 3 to 6 month opportunities within our partner hospitals overseas, which has been on pause through COVID, so we haven't had anyone for a while. We also have short-term opportunities. So individuals, volunteers will go overseas, for example, a week to deliver workshops, trainings. And then in addition to that, of course, they're coming back and still getting involved in all the regular meetings and virtual engagement. And then we just now are sort of focusing a lot more on solely virtual engagement. So all of our volunteers have been doing this throughout COVID. So just logging on online, we've had webinars, a lot of email exchanges, support, for example, developing some guidelines, all of these different activities that are just taking place purely online, which is proving really successful and really helpful for some people that have children and can't commit to sort of spending a week or a month, etc. overseas. It's a great alternative opportunity. And then also we have just UK based. So sometimes we have partners coming to the UK. It might be that volunteers within Cambridge are hosting them, or you're simply joining all of our regular partnership meetings, inputting in other ways into the health partnership activity, but not necessarily involving any travel. So yeah, this sort of armchair volunteering style. So yes, that's what our sort of different varieties of volunteering look like, but we are very much involved from recruitment all the way through to sort of debriefing, and beyond. Volunteers generally stay involved with us for a very long time, and yeah, are a huge part of how we deliver our activity. So they're very, very important to us. And we do make sure that we select individuals based on their skill set and matching that to what the health partnership is trying to achieve, but also that we get really fantastic multidisciplinary teams with a real breadth of experience in those different volunteering teams, which we feel is really, really important. So I just want to touch on why Cambridge is so supportive. And we do find that Cambridge University Hospitals, which has been our original sort of our first partner hospital in Cambridge, has really championed global health engagement for its staff. we have done a few studies, and we know that it has a triple win effect. It has, you know, engagement in global health partnerships leads to a win for the overseas partner, unsurprisingly, the training, capacity building, etc. But it also leads to huge benefit for the NHS staff member. We find that they come back with greater resilience, better resource management, among lots of other skills, and have noted that quite a few of them end up sort of progressing into quite senior positions quite quickly. And this is recognised by the trust. And equally, it has huge benefit for the trust. You know, it's known that it leads to greater patient or improved patient care, greater staff retention, and also improved reputation, among many other different reasons. So we make a real effort to document this and to report this regularly to the trust. And another study that we did, and these can be found on our website, so if anyone's interested to delve a little bit more, please have a look, is a social return on investment that we did against one of our health partnerships, El Salvador, and it was sort of quantifying this benefit, the benefit for the overseas partner and the benefit for Cambridge University hospitals. And as you can see, it was quite significant. So we, you know, just to say as well that we really actively encourage all our volunteers to share their experiences within their departments more widely, and find that some departments are huge advocates of global health engagement and health partnership volunteering. And that's something that we really try and push, and we try and offer all our volunteers forums and opportunities to share as much as possible. Yeah, just to continue pushing the global health agenda. So yeah, so that's me. And just to say, if anyone's interested, please feel free to contact us and have a little look on our website. We've got some pages that have information about impact, and you can have a little look through those. And yeah, we're also on social media. So I hope that's helpful.
Fantastic. Thank you so much, Sophie. That was really helpful, and hopefully really helped to orientate people with how this works within an NHS trust and as a core health partnership. And the website details just some of the impact that the Cambridge Global Health Partnerships team have had, but I don't think it goes far enough in demonstrating how vast it is, and that work done on benefits is hugely beneficial to so many as well. We've had some great questions in the chat, which hopefully we've been doing our best to answer, but does anybody have any questions for Sophie, any reflections on working within a trust and how to get involved, or on any of the opportunities that Sophie spoke to just now? And if not, we will move on to Emma, who has joined us straight from the end of a shift. I can see her rushing to get lights on, poor thing. I'm just going to ask, yeah, there we go, fantastic. So I'm really, really pleased to have Emma joining us. She is also well known to the Going Global series, and both to Helen and myself for her phenomenal contributions to many webinars and workshops before now, but also globally as well. So I'm really pleased to hand over to Emma, who's going to speak directly to her own experience globally and what's come about through that. So thank you, Emma. I hope you managed to grab a cup of tea or something as you finished the shift.
Glass of water. Thank you for that big up, Charlotte. Hello, everybody. I can't actually see who's online, which is probably just as well. And this was a little tiny bit last minute, so I haven't brought my slides. So unfortunately, you're just going to have to look at my face. But as Charlotte said, I've been a volunteer, and I know Helen Slattery, I think, is online here somewhere.
Yes, she is.
So I'll just talk about what I did and how I came about choosing where I went and things. So I work at MFT, which is in Wythenshawe in Manchester, and I took a career break in 2017. I gave my boss loads of notice and actually took a year off. So it was hard for them to say no. I gave them an 18-month run at it. So I actually took 15 months in the end, but that was sort of more personal reasons. So I decided in that time, I went to Uganda for 4 months and went to Gulu in North Uganda. And I also went to Bangladesh for 2 weeks on another experience. And then I went back to Gulu in Uganda and did something a little bit different than the first time. So as a volunteer, I went to Gulu with the Gulu Man Link, which is organised through the hospital. And it was a really, really well supported link. So for me, as a volunteer, there was loads of support before I went. So help with visas, what jabs I might need, or at least directed to the clinics and things for my jabs, and all the red tape and what to expect and everything else. So as a volunteer, I was well prepped as much as you can be for going to Africa for the first time, to sort of go and volunteer in the hospital. So that was a great experience. I went as a staff nurse. I'm actually a ward manager, but I went and thought I will buddy the ward manager, and we can share experiences and maybe do some sort of training at that kind of level. So that was my informal remit of what I was going to do. And it doesn't work like that, generally speaking. I think when you go and volunteer abroad, you may go with one remit and then actually find that you're doing something a little bit different. So in the event, the ward manager wasn't interested really in sharing ideas or learning, or I don't know why. I mean, how would I feel if another manager came and buddied me for 3 months from another country? I'd just feel like, you know, thank you, no. So that was difficult, but the nurses on the ward, there was still capacity to be built by doing things that had worked on projects already. So because Gulu Manlink had a remit already there, I was able to expand on projects they were already involved in, like doing observations and medication and basic simple care like that. I think you have to be flexible as a volunteer. So I would grab literally any opportunity. There was loads of students on the ward and I would just be like, right, I've got some free pens. We'll go and clean these beds, which definitely needed cleaning. And we'll talk about asthma care, and I will do questions and answers on asthma care, and whoever comes can have a free pen. So slightly bribery techniques, but we were cleaning and teaching, and that's it. Somebody donated a chest drain. Very randomly, a chest drain arrived on the ward. And I was like, okay, let's just do some teaching on chest drains. So I think there's opportunities, like in the UK, you just grab them and be enthusiastic and be prepared to be flexible. My second adventure was to Bangladesh. It was 2 weeks. It was funded by myself. It was very expensive, and it was with an American organisation. And having been with with Gulu Manlink, that organisation was very different. They were not very organised. I asked questions because I knew a little bit about, I might need visas, I might need risk assessments, I might need this. And they couldn't provide the reassurance that I needed until I was practically on the plane. So that was a note to self about choosing the right organisation, really. And I went for 2 weeks. So you think, can I build capacity in 2 weeks? Can I make a difference? And yes, you can. You can volunteer for a short period of time and make a difference, but it was providing a service in the clinic that was ongoing, and they needed people to deliver that service every week. So in that sense, yes. And in another sense, I'm a ward manager. So, you know, on a rainy day, I thought, right, okay, no patients. I will make an asset list of all the stuff in the clinic. And then when the volunteers need to know what to bring, I'll be able to say, you need these batteries for this equipment, or you're running short of this and that. And I can find jobs everywhere. So that was useful. And then I went back to Gulu for another 3 months and worked with a different ward manager who was very receptive, and we shared loads of ideas, and we had the same problems with the same personnel. And it was really interesting to go back a second time and to help her. She was really happy to have a buddy, and I was really happy to be back there. And that was a very different experience. I think challenges wise, it's you have to accept that it's a completely different culture. I'd never been to Africa. I hadn't even really looked into what had happened in Gulu, which was some pretty horrific things in the Civil War. So, and the healthcare system is totally different. You know, there is a lot of absenteeism. There will be people that steal the drugs that that the hospitals provided. The nurses will steal the drugs, and you do have to sort of be able to deal with these challenges. But I was with a supportive organisation, so they helped me with everything. That I could always find somebody to WhatsApp and say, I'm come across this Emma dilemma and I need some assistance. And I was in a safe house with Wi-Fi, and it was a good experience in that sense. So really, that was my experiences of both coins, really. Going with an American organisation that wasn't particularly well run, and there were some issues before and during my time there, and also being with an organisation that was exceptionally well run and well organised and extremely supportive. So that was my experiences, really. A little bit off the cuff chat. I hope that was kind of what everyone was expecting.
That was fantastic. Thank you so much, Emma. If you don't mind, I'm going to ask a couple of questions, probably to you and Helen, if that's okay, because I know that Helen being the leader of the Gulu Man Link as well. So Helen, I wondered if you had anything that you'd like to add sort of as a response to anything that Emma's noted around the organisation and support, as well as obviously managing expectations, which is one of the upcuts, a plug for one of the series webinars coming up, but there will be one around that. But Helen, just over to you if you had any initial responses. Oh, will you just unmute yourself? Thank you.
There we go. Yeah, as Emma was talking, it was mindful to say to people, if you're going to go with an organisation, make sure you do your homework and find out what you're signing up to and what they offer and what they don't offer. There might be organisations that pay you for volunteering and your time, and others that may not. And the more homework you do, the better prepared you'll be and the less surprised you'll be. And also, as Emma said, do your country homework as well. You know, so that you're arriving, it helps you understand the people that you're working with and the circumstances that they're in, and why things are done in a particular way. And be mindful that these the places that you're going to go to often have reams of volunteers who come in with all sorts of ideas, and this can be quite tiring and exhausting for our overseas partners. So I think a phrase that my manager, Fleur Kitzel, uses a lot is be curious. So go in with curiosity. Why are things done like this? Rather than thinking about NHS and we always do things like this and this is the reason why. And I think Emma's point was really vital. Be really flexible if you possibly can. And if you're not someone who enjoys being flexible, it's a good learning opportunity. I had a manager come out once on one of our projects who said that that was what she learned from being part of that experience. She said normally she liked everything to be planned and be very rigid and set and knew what was going to happen next. So she found it really challenging that things were not always in that way, and timeframes, for an example, don't really work the same. If you think something's going to happen you think you might meet someone at 10 o'clock, but no, they might not have even come by 12. But that's okay. It's because we're not in the NHS in England. So, you know, there's lots of differences, but I think the differences really make the experience. The reason people want to do volunteering is to experience something very different from their day to day. I think Emma would agree with me that that's why you chose to do it. You wanted some refreshment and to have new challenges and something that was different, and a volunteering opportunity provided that.
Thank you, Helen. And Emma, I just had a question about sort of your return to the NHS and sort of whether you'd say there was anything that you brought back with you from each time, or things that made you sort of think differently about processes, perhaps.
I think, like Sophie said, you definitely have that emotional resilience. I think you can't help it because I went on my own. Although I had an organisation supporting me in the UK, you are there on your own, and like it's sink or swim. So you definitely come back and you've found stuff about yourself and you've developed that resilience, absolutely, for sure. And you're working in a low resource setting, so you have to adjust to that when you come back, because you come back to the not the excesses of the NHS, but we do have what we need, don't we, generally speaking, and you have to adjust yourself back to that, I think, definitely. But yes, and also, as Helen said, you know, it gives you a break from the NHS. I think when you go and work in a ward environment where they don't have a telephone that's going even, or a buzzer for the patient, or, you know, a computer even, it's just, it's grassroots nursing, and there's nothing wrong with that. It's absolutely lovely, actually. Yeah.
Thank you, Emma. Sophie, I wondered if I might come back round to you and see if you had any initial reflections, but also, I mean, obviously Emma was able to travel and sort of get on an aeroplane, which just seems rather unfamiliar to a lot of us now. And I wondered if you might sort of reflect a little bit on how Cambridge have adapted in the last year to that. I know you've offered some rather exciting and different opportunities to the one that Emma was able to be a part of.
Yeah, absolutely. And yeah, we're trying to offer virtual opportunities, and it's certainly something that we're quickly developing expertise in, because of course our previous model was that people would travel. So, you know, we are looking at how we can, we've quickly introduced virtual technologies into our partnership, so regularly using Zoom, but also improving things like WhatsApp use, other different bits of tech that are really helpful in maintaining those partnership links and opportunities for healthcare workers to engage on both sides of the partnership. So it's certainly something that we're developing more of. Another thing that we've been doing recently is getting volunteers in the UK to do some videos. So they're developing some trauma and orthopedic videos here in Cambridge, and then we're sharing them with partners overseas. So there's also some things like that that you can do based in the UK that can be used overseas, and you're still volunteering your time and expertise, but perhaps in a slightly different way. You know, you're not traveling, but there's a huge amount that you can still give at a distance. Yeah, so but we're definitely learning and finding different opportunities for people all the time, and different ways of delivering activity all the time.
Sorry, I'm talking to myself. Thank you, Sophie. I can just see that Steve has raised his hand. Please do go ahead, Steve.
Hi, thanks very much. I actually represent the British Association of Urological Surgeons, so we're coming at it from a slightly different angle. And Urolink's been around for about 30 years, but the last 18 months has really been very challenging. But we've been lucky enough to set up a whole series of webinars with Lusaka in Uganda. And I'll put up a link to our website so that everybody can access, because everything on it is open access, and people can go if they're interested in anything urological and see what's happening. But we've also been utilising technology in other ways. There are various things like HoloLens and Proximy, so you can actually real-time mentor people remotely. Of course, that does depend upon the availability of electricity. And certainly when I was last in Ethiopia, I came back on the 15th of March last year. So just a week before everything locked down. We had no water for a week. And this was in a regional teaching hospital. And everything that we use has to be battery powered, because you can't rely upon electricity. You certainly don't want to be in the middle of something moderately complex when the power goes down. So virtual really has revolutionized things. And in fact, we've got an executive meeting with Urolink tonight, and all of our partners all over Africa will take part in that, which is great because they can still tell us what they want, what they need, how we can help them. And then we can try and figure out what we can do to help in this sort of situation. So sorry for butting in, but I just thought it might be helpful.
No, that's fantastic. Thank you, Stephen. And hopefully as well, that's gone some way to answering Claire's question as well, which came in about sort of what kind of projects and activities can you get involved with armchair volunteering, and I think Steve's given a perfect example of that, but Sophie as well has touched on it, and hopefully in a few weeks' time as well, Helen and Fleur will be running a webinar on exactly this. There you go, it's ahead of me, in October on virtual volunteering, where you'll be able to hear directly from volunteers who've been involved in virtual opportunities so far, and how they go about doing that. But there are some fantastic, exactly as Steve touched on, initiatives that have popped up.
I just see that something's popped up, Charlotte, with regard to the virtual systems, and they're either the the Microsoft system HoloLens, or there's one called Proximy. There's also one called something Lightning. my mind's gone blank. But the whole point about it is that there are a number of different things that you can do. The other thing that we've been doing is we've been running virtual basic skills boot camps. And this is just an extrapolation of something that was set up in the UK. It had been used in Kenya and in Uganda. And now they're being run locally with support, virtual support, remotely. So yeah, if you can get the ball rolling, it'd be great. Just to go back to what you can do as an armchair volunteer, I actually retired from the NHS 4 years ago. I now run the website. And that's an incredibly important function, because I wouldn't really have known about this webinar series or much more about THET, and wouldn't have been able to put it on our website and all of the other bits and pieces. And I think that there are loads of things, no matter where you are in your career, that you can do that can be incredibly helpful. And one of the roles that I see is that I facilitate people who are working being able to get out there and do the things that they need to do. So yeah, I think there are loads of things you can do from an armchair.
Thank you, Steve. Yeah, I couldn't agree more. I think that's really true. And there's so many opportunities now, and hopefully we'll get back to volunteering the way Emma did as well. But it is opening up so many opportunities for those who can't travel, even when there aren't restrictions. And as we saw, that's one of the barriers to engagement as well. So I think the last 18 months has been so helpful in providing those opportunities. So we have a few minutes left, and so that we finish on time, because I know that lots of people are going back to shifts and off to other things, but I wondered if I could just ask each of our speakers, Emma, Helen and Sophie, perhaps just to share sort of one thought about, or for those thinking about starting global volunteering experience, or who are in the midst of global engagement work, and what your sort of, I suppose, message to them might be as we finish up with the first of our 8 webinars. Emma, you're off mute, so I'm going to go to you first, if that's okay. No pressure.
One take-home message, is that, Charlotte?
Yes, please. Yeah.
Oh, only one. Plan ahead. I think planning well in advance for me was absolutely key. And if I could have 2, I would say choose your organisation carefully.
Thank you, Emma. Yeah, really important. I know you. Fantastic. Thank you so much. Helen, you're off mute as well, so I'm off to you next.
Yeah, this is challenging just to think of one, to be honest. I think carefully about what you're going to be involved in doing, and think about the long-lasting effect it will have on your partner organisation, whoever you're working with overseas. What you don't want is to do something that then just creates a vacuum when you leave, and there's no follow-on planning. So look for how might something you're involved in continue after you leave, potentially. Sort of have that thought in your mind.
Thank you, Helen. Yeah, that's great. Sustainability is key to all of this as well, and Emma showed that with going back as well to Guliman, so thank you. And Sophie, to you.
Yeah, I suppose I'd say, share your experience as much as you can as well, within your networks. I think it's sometimes quite difficult to talk about it immediately, and people will say, oh, how was it? And it's very difficult to just easily explain your experience. But you know, it's in an ever increasingly so globalized world, you know, it's great to talk about global health experiences and share them, because we have a lot to learn from others. So yeah, I would say, yeah, talk about your experience, talk to others about it.
Fantastic. Well, if you didn't hear anything else but the last 3 minutes, I hope that those 3 takeaways, or 4 with Emma's extra one, have provided a lot of food for thought. And as I say, as we sort of conclude the first of our 8 webinars in the series, I'm really pleased as well to be sharing news of a conference, hopefully that you'll all find of interest. I know lots of those on the call are contributing in different ways. I can spot a couple of speakers online, which is lovely to have you with us, but you'll also be seeking out the conference, which is coming up very soon. So we are running a 4-morning conference at the beginning of October, which really sort of brings all of this together, and with contributors from across our partner countries overseas, and with global health experts, including Professor Chris Whitty's joining us, Dr. Leah Tedessa, the Health Minister of Health for Ethiopia. We've got Elizabeth Iro, the Chief Nursing Officer for the WHO. My list continues and my mind's gone blank, but we've got some phenomenal keynotes over the course of the 4 mornings, and some great breakout sessions where there'll be lots of space for sharing contributions like Steve has done, and hearing from volunteers like Emma as well. So I hope you'll join us and take full advantage of the discount code that's there that we'll follow up with. And my final thought is just to say I really hope that we'll welcome you back over the next 7 weeks, every Wednesday afternoon from 3 till 4 p.m, where we'll welcome a different set of speakers on a different theme. And next week is looking at digital engagement, in a global era. So how to best prepare to do so using digital technology. And then the series will continue with workshops including virtual volunteering, ethical communications, managing your learning and leadership, as well as sort of making sure that your expectations are manageable. As Emma said, change can happen, but it's good to have an idea of what change is possible, so as not to set ambitions too high for anyone involved. So all that's left to say, and I think we're spot on 4, which is great. So it's just thank you so much for joining us today, and I look forward to welcoming you back next week. Thank you, Helen, Sophie and Emma as well. Have a lovely evening. Take care, everyone. Thank you.